Welcome, 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 coders, to week 9. This week, we will be diving into HCPCS Level 2 and modifiers. This is a crucial step before we tackle CPT coding in week 10. So get ready to learn how to code for medical supplies, equipment, transportation, and also learning to master those essential two character modifiers. Okay, before we go any further, I gotta introduce my team. So just wanna just shout them out really quickly. They are our instructors who dedicate themselves each week to making sure that they are here to support you. I'm gonna call them by name. Miss Dolly, Mr. Sandeep, Miss Bianca, Ms. Mills. Did I forget anyone? No. And our interns, there are too many to name, but they are wearing the blue badges and they're here to answer your questions. Just encourage you and keep you going. All right. Now, I got a disclaimer. The disclaimer is if you're not familiar with CPT coding, we highly, highly recommend that you watch our beginners lectures. There is a link that we will share with you at the end of this discussion. And these are the two that you need to watch. CPT coding for beginners, parts 1 and 2. Also, what's going on at AMCI that pertains to you? Well, the Chun class videos will begin May 26th in the Discord. You can find them there. This is for the gold and platinum members, and essentially we're going to apply to practice what you've already chunned. So make sure you get at least integumentary done this week, next week musculoskeletal, and keep going because we are going to show you how Chun is effective when you take your exam. So it's something you don't want to miss. If you can't make it, you can watch the playbacks. Also, starting next week, you will be able to participate in our interactive medical terminology anatomy in Discord. It's for all members. You don't want to miss that either. This is one of our most um, popular classes. People love to come. You're going to learn medical terminology, anatomy in a fun way. Yes, through games. All right, speaking of games, we brought back AMCI Game Night and we did it starting last week. It was incredible. We played Jeopardy, Hangman, and we learned a lot. So come and join us. It's 7:30 p.m. Eastern Standard. So make sure you're there. It's in Discord and it's for all members. Also, just want to point out the books for weeks 9 through 16. We're going to use HCPCS Level 2, CPT 2025 if you have it. If you're testing in 2025, you should have it. Also, your step by step by Bucks and also the MCG manual. We'll begin assigning homework out of the MCG manual next week. Goals of the presentation for week 9. Number 1, we're going to review HCPCS Level 2 coding as well as modifiers. And we're going to apply what we've learned to practice. And finally, hopefully, we'll move you one step closer to medical coding mastery. Now, let's talk facts about HCPCS Level 2 codes. Number 1, HCPCS codes are used for supplies, equipment, procedures, and services. And remember, these are Level 2 codes. Do not confuse HCPCS codes with CPT codes because CPT codes are HCPCS Level 1 codes. I'm going to let that marinate. Just a moment, just for a moment. Now, HCPCS is maintained by the Center for Medicare and Medicaid Services, or CMS. And specifically, these codes are used to report supplies, drugs, transportation services, etc. And we're going to get more into it. And again, um, these are level 2 codes, and the types of level 2 codes that are in the HCPCS manual are permanent codes. The permanent national codes are 5 characters long, and they also have temporary codes. And HCPCS Level 2 codes are updated quarterly. And if you wanted to know, this is what a HCPCS Level 2 code looks like. It's 5 characters long, and it begins with a letter. All HCPCS codes do. And as I've stated before, CMS maintains HCPCS Level 2 codes. In other words, they're responsible for these codes. And CMS mandates using HCPCS Level 2 codes when you have Medicare and Medicaid patients, but often will be coding for Medicare patients. And when the documentation states that this is a Medicaid or Medicare patient, you must use HCPCS Level 2 codes in lieu of or instead of CPT codes. Yes, so you don't have to guess when a patient's 75 years of age, you don't guess that they have Medicare. Make sure the documentation states that they have Medicare. And you'll see procedures like colonoscopies, breast exams, or immunizations. Those three are more common on your exam. When you see that and the patient has Medicare, make sure you use a HCPCS Level 2 code if it's available. And I did mention that HCPCS Level 2 codes are procedure codes. They are. So you won't see the more invasive procedures. You'll see procedures like scopes, colonoscopies, anoscopies, sigmoidoscopies, so scopies. That's common. And also, HCPCS Level 2 codes are supply codes, medical transportation codes. Yeah, so you'll be coding for drugs, biologicals, um, medical transportations like ambulance, um, orthotics, prosthetics, durable medical equipment, and more. Essentially, anything not in the CPT manual you'll typically find in HCPCS Level 2. Now, all HCPCS Level 2 manuals are not the same. They are not. Previously, I don't know about 2025 or thereafter, often 360 does not have illustrations. They may have it now, so let me know. Type in the chat. But some of them do. We are currently going to be using this AMA version, and their illustrations are phenomenal. However, all HCPCS Level 2 manuals have an index and tabular list. So it's pretty much situated like the ICD-10-CM manual. All right. Also, there is a table of drugs, not the same as ICD-10-CM. We will review it. And modifiers are also classified a little differently, and we will review that as well. So make sure that you learn your individual HCPCS Level 2 manual and go ahead and type in the chat. Let me know what type of manual you have. All right. Which publisher do you have? Do you have Optum? Do you have AMA? Do you have AAPC? Do you have AHEMA? Let me know. All right. But most HCPCS Level II manuals have the following. They'll have an introduction. Most have anatomical illustrations. Some don't, but most do. You'll have an index to service, you'll have a tabular list, and you'll have appendices. In this AMA version, we have Appendix A, that's where the table of drugs and biologicals are. Appendix B, you have your HCPCS Level II modifiers. C, list of abbreviations. D, place of service. E, payment status indicators. If you are studying for your facility exams, specifically your CCS, this is gold. Make friends with Appendix E. This is how you code outpatient facilities with those status indicators. Appendix F, ASC payment indicators, you'll need to know that as well. And this is for facility coders. Appendix G, column 1 and column 2 for correct coding edits. You don't review these when you are coding for professional for those exams, but you'll need to know it in the real world. So if you're taking your CCS-P, we do review column 1 and column 2. If you're taking your CCS, we definitely do. All right, I'm just saying AMCI. All right, Appendix H, your general coding guide, your general correct coding policies, and Appendix I, publication references. So let's go ahead and get a glimpse of the AMA HCPCS Level 2. We're just going to open it up, and this is what it looks like. So you basically see your annotations, your symbols, and more. Conventions, anatomical illustrations. Beautiful. I love it. And this is what your index looks like. Now, this is the index. And again, if it's CMS, if CMS is involved, the index is in the front of the manual. Most manuals outside of HCPCS Level 2 are in the back, but CMS puts their index in the front. All right. It is alphabetized. So whatever the supply, drug, service, etc., it's in alphabetical order. After you've looked up your code in the index, then you have to scurry on over to the tabular list. And I love this tabular list because everything is organized or classified to a letter. When I see A, I know A is transportation. Also, A is medical and surgical supplies. B is enteral and parenteral therapy. So if you have an ostomy, this is where you're coding. Also, outpatient prospective payment systems. You all don't deal with this if you're studying for your professional exams. Only facility coders deal with outpatient prospective payment systems. Durable medical equipment, or DME, is found at the E classification. These are things like hospital beds, wheelchairs, and crutches. Professional, procedures and professional services are found in the G section. And this is like what I've said before, your ostomies are found here. Even injections or immunizations are found here. Please excuse me. Immunizations are found in the G category. Also, alcohol and drug abuse treatment, drugs administered other than oral. Right here, this J. These J codes are going to be a biggie on your exam, and we will review them. Also, chemo drugs, temporary codes. Also, the L category, you can find orthotic devices. Orthotics are used to align deformed body parts or correct them. Also, prosthetic devices and procedures are also found in the L classification. You've got medical services in M, pathology and lab found at P. You have temporary national codes at Q, temporary national codes non-Medicare, S. Diagnostic radiology, R. National codes established for state Medicaid agencies, T. Vision services, V. Coronavirus services, U. All right, so we know what U is. It's the same for ICD-10-CM. And also some publications have D classification for dental. Now, let's go ahead and let's look at those J codes, the injectables. When a provider provides an injectable drug, not administers that drug, but they provide it, you will need to use a HCPCS Level II injection code. And these codes are selected based upon the drug, the dosage, the route of administration. And the HCPCS Level II codes are found at the table of drugs. And do not confuse this with ICD-10-CM drugs and chemicals. No, they have a table of drugs and chemicals that are used when you have poisonings, but these are used when a provider provides the medication or the injectable. And this table will provide you with a J code. And yes, you can code directly from the table of drugs. You can bypass the index and go directly to the table of drugs, but you should always go verify that code in the tabular list. Now let's take a look at the table of drugs, and it looks like this. So the drug name, the dosage, the method of administration, like how the drug access the body. And again, coders, we're not coding for the administration, but we need to know the method. And the HCPCS Level 2 code will be here. And of course, they are J codes. All right, so one of the things that you need to know are you need to determine the route of administration. So let's go ahead and review them. And the routes are here, and these are the abbreviations. Now let's just put it up close so you can see it. IA. When you see IA, that means intra-arterial. That means it went through the artery. IV, intravenous, through the vein. IM, intramuscular. IT, intrathecal. That's at the base of the spine. SC, subcutaneous. INH, this is inhaled. VAR, this is various routes of injection. It could be joints, cavities, tissues. OTH, other routes such as suppositories, catheters, etc. Oral, we know what that is, through the mouth. Okay, so these are the routes of administration. You'll need to know it because the table of injectables will require that you know before you select the code, and we're going to show you in a moment. Now, let's talk about HCPCS Level 2 modifiers very briefly. All right, so what is a modifier? A modifier is a two-character code. And when you add this two-character code to a code, whether it's a CPT or a HCPCS Level 2 code, it modifies that code. Either it can enhance it or take away or reduce the value of the code. Let me explain. All right, so if a procedure took place, let's say a doctor carried out a cesarean section. This might not be a good example, but we're going to use it. We're going to go with it. The cesarean section. And let's say that the the patient had a previous C-section and there were adhesions, abdominal adhesions, and the procedure took a little longer. All right, so we only have one C-section code that we can use for that procedure. However, a modifier can give more clarification and let the biller know, hey, or the insurance company know that, hey, this was more extensive. So this modifier will tell the insurance company that it was more extensive. And if you use a specific modifier, that provider could get more reimbursement for that complexity. Modifiers do things like tell you the side of the body or laterality. We know LT is for left, RT is for right, right? Also, you'll learn when you get to CPT anesthesia, patient status modifiers. These talk about the status of the patient and more. But just so you know, modifiers are two character codes. When added to a code, whether it's a CPT code or a HCPCS Level II code, it will give you more or additional information about a service, procedure, or supply. And right in front of you, you have two types of modifiers. You have Level 1 modifiers. Level 1, remember I said HCPCS Level 1 or CPT modifiers. Yeah, and CPT modifiers only have numbers. That's how I can tell them apart. Whereas HCPCS Level 2 modifiers, they have a minimum of one letter. Now, our example shows two letters, but HCPCS Level 2 modifiers have a minimum of one modifier, and that's how you'll be able to recognize them on site. And one final thing, you can use CPT modifiers and HCPCS modifiers with any code. So HCPCS modifiers can be used with CPT codes. CPT modifiers can be used with HCPCS Level 2 codes. Now, let's go ahead and let's switch gears and let's talk about these Level 2 modifiers. Let's go look at them. All right, so this is what they look like. And as I've said before, you have to have a minimum of one letter. So A1, A2, going down, we can see that these are all HCPCS Level 2 modifiers. Now, I want to switch gears and talk about ambulance modifiers. So, medical transportation. So basically, they are listed under HCPCS Level 2, and these medical transportation modifiers have more nuances than traditional modifiers, so I want to go ahead and discuss them. But pretty much they are two character codes, but these codes, the first character of the two characters have meaning as well as the second. The first specifies the origin of the patient, and the second is the destination. Yeah, so first is origin, second is destination. So if a patient is going to the hospital, you'll use an H. If they're going to a nursing home, you'll use an N. If they came from a residence, you use an R, etc. So all of the designated modifier characters have meaning. So let's go ahead and review them. All right, so these are your level 2 ambulance modifiers. And D, if D is used, that's for diagnostic or therapeutic site other than P or H. P is physician's office, H, hospital. E, this is residential, residential domiciliary custodial facility other than an 1819 facility. We'll get into that later, maybe. All right, G, this is hospital based end stage renal disease facility. H is hospital. I is site transfer. So, site of transfer. So, an airport or helicopter pad between modes of ambulance transport. So that is, this can occur but not as common. J is a freestanding ESRD facility. N is a skilled nursing facility. P is the physician's office. R is residence. S is scene of accident or acute event. Or X, intermediate stop at physician's office on the way to the hospital. All right, so this is a destination code only. All right, coders, I don't expect you to remember that. But there are some key ones that you'll use more often. You'll use the H, the P, the R. Those are the most common if you ask me. Now, let's take a look at these ambulance codes. So we know the modifiers. Where do these modifiers go? Well, who do they go with? Well, they go with the ambulance codes. And by the way, I did say that you can use these ambulance modifiers with any code. If there's no ambulance code in CPT, you can't use it. Just saying. All right, so here is what the ambulance codes look like. A0000 through A0999. Again, HCPCS Level II codes are 5 characters long. So this is what they look like. And then you'll append your modifier. So you might say, why are you showing us this, Mrs. J? Let us get into it. Yeah, let's go ahead and let's look up an ambulance code with a modifier. All right, coders, let's do it. All right, so this is basically how you look up a HCPCS Level 2 code. Number one, you look up the main term in the index. That's the front of the manual. Number two, you verify that code in the tabular list. Number three, check your guidelines and read your notations. Simple enough, right? All right, so now we're going to look up an ambulance scenario. We're going to do an ambulance scenario, look up an ambulance code. Let's go. We're going to do it together. All right. A 72-year-old patient experiences chest pain and collapses at home. Emergency services are called and the patient is transported by ambulance to the emergency department of a local hospital. Oxygen was administered during the transport. Okay, coders, what do we do? All right, coders. So the first thing that you do, you're going to have to highlight your ambulance services, right? So we have an ambulance and also oxygen was administered during the transport. So let's go ahead and look up our main term in the alphabetic index. And in alphabetical order, we're going to find ambulance. And it directs us to code series A0021 through A0999. Then, step two, we're going to verify the code in the tabular list. Yeah, we do have to scan a whole lot, but it wasn't difficult at all. All right, so I scanned and I was able to find A0429. This is the code for ambulance service, basic life support, emergency transport, or BLS emergency. Now, some people might say, well, I think it might be A0428. So this says ambulance service, basic life support, non-emergency transport. Coders, this is where we get to use our discretion, right? Yeah. So is this a non-emergency? This patient has chest pain and they collapsed. That patient could be having a cardiac event. That is your most vital organ, or one of them. I think it's the most vital, but Some people say it's the brain. All right. So, if that's the case, it is an emergency. And also, if a patient goes to the ED with chest pain, often they are seen first. So, it is an emergency. I would not say it's a non emergency. So, A0429 is my code. Now, I have to look it up in the well, no, I don't have to look it up. This is the tabular list. Coders, yes, this is the tabular list. I'm used to all these words. Okay, so A4029 is the code. Now we have to go grab our modifier. Remember, the first character is the origin, the second is the destination. All right? So if we're looking at our list, our origin is what? Well, the patient collapsed at home. The second character is our destination. Where did they take the patient? Well, they took the patient to the emergency department of a local hospital. So the first character is an R, right? If you look at R, it's residence, and the second is an H, hospital. So our code will look like this: A4029RH. Okay, coders, how are you doing? Well, I do want to tell you that I'm using the AMA HCPCS Level II version, and my modifiers are found after the index, specifically after the table of drugs. Yeah, the injectables. All right, coders, so now we're on a roll. It's time for you to do your thing. I want you to go ahead and look up a code. It will not be an ambulance. So let's do it. Okay, coders, it's your job to look up silicone breast implant. What is your main term? How did you do, coders? All right, were you able to locate that main term? So if you study with us, you could have figured it out. So it's the same premise as ICD-10-CM. When you're looking for the main term, it is the diagnosis, it's an eponym, or if you don't know, it's the word that's doing something. So, of silicone, breast, and implant, which is the main term? Well, if you don't know, it's the word that's doing something. And of the three, implant is the word that's doing something. Yeah, so let's go ahead and look up implant in the index. Index is in the front of the manual and it's in alphabetical order. So if you look up implant, implant of what? The subterm breast, and it takes you to L8600. Step 2, verify that code L8600 in the tabular list. And boom, L8600 is implantable breast prosthesis, silicone or equal. I like it, but step 3 says, check your guidelines and notations. I don't see any guidelines or notations in the tabular list, so L8600 is our code. So coders, how do you like that? I love looking up HCPCS Level II codes. Now, some of you, if you have different publications, you may have different codes. So I probably should keep reminding you because some people really get frustrated in this section because some people are using older publications and you're going to have a different code. So my advice, just look up according to your book. That's all you can do. All right? So choose the code that is available in your book. I mean, that's all you can do, right? Don't get upset or flustered. It's not going to be a game changer. I promise. All right, now let's go ahead and switch gears. I want to show you how to look up an injection. How to look up an injection. Number one, you will document your key terms. You need to document the name or the type of medication. Number two, the amount of medication. And three, the route of administration. Number two, go ahead directly to the table of drugs and look up your drugs or drug. Number three, verify your code in the tabular list. And four, verify all guidelines and notes. That's it, coders. I think you can do it. Here's the first exercise. Michael was born without testicles. He arrives today to receive an intramuscular injection of 5 milligrams of testosterone ethanoate. All right, coders, your time begins now. And also, as a reminder, don't forget to document or highlight the name or type of medication, amount of medication, and the route of administration. How did you do, coders? How did you do? All right, so did you document those keywords? Those keywords will help you. Remember, you have to document the type of medication. In our case, it was testosterone ethanoate. Also, the route of administration. Where was the patient injected? Intramuscularly. And the amount, the dosage. In our case, 5 milligrams. All right, coders. Now let's go ahead and look up our code. All right. So step 2, let's go straight to the table of drugs, and we're going to look up testosterone ethanoate or ethanoate. And here it is. And 1 milligram here, intramuscular, J3121. Now, step 3. Let's go verify this code in the tabular list. J3121, injection, testosterone, ethanoate, 1 milligram. Wait a minute. The drug is correct, but we only are coding for 1 milligram if we use this code. What do we do? All right, we need 5 milligrams, right? So go ahead and code for 5 milligrams of J3121. All right, coders, did you do that? If you did, way to go. If you learned something, it's priceless because you're going to do it. You're going to do it again. All right. Step 4, we have to check, verify any guidelines. There are no guidelines. So therefore, our code is J3121 times 5. All right. You ready for another one? Let's do it. After receiving chemotherapy, the patient begins to experience nausea and vomiting. She arrives at her physician's office for her EMIND treatment. 1 milligram was administered intravenously. Okay, coders, time to do your thing. Your time begins now. How was it, coders? Is it getting better? I'm pretty sure it is for some. And for others, it might take a little longer, but it is okay. You are the captain of your ship. Don't try to be at someone else's pace, and your time is perfect. Okay, coders, first things first, we have to document our keywords. Our keywords, what is the type? Type of medication, emend. How much? 1 milligram. And how was it administered? Intravenously. Okay, if that's what you said, way to go. Now let's go look up our code. And remember, I'm saying it again, you can go directly to the table of drugs. You can go right there. So don't go to the index. You can go right to the table of drugs, look up your emend, and boom, here it is. J1453 and J8501. There are two codes, so we got to do some reading. All right, so J1453 says that this is emend. See that little supplemental note or supplementary term, emend? J8501 is also emend. So how do we know which code to choose? Let's look a little closer. Well, if I look at J8501, this is aprepitant oral 5 milligrams. And I'm going to say this is not correct because remember, we have an injection that was administered intravenously, and we cannot use this code. Also, this is the code for 5 milligrams. So it's wrong. And I hope J1453 is correct. I hope it has all of the elements or we have a problem. All right, so J1453 says injection 1 milligram. And intravenous is an injection, right? Yeah. All of the routes that I've shown you pretty much are injections, with the exception of the last three. But an intravenous injection is an injection. All right. So we've got 1 milligram of an injection. I like J1453. There are no notes to check or guidelines. So therefore, my answer is J1453. All right, coders, were you able to deduce what the answer was? If you did, if you were, way to go, way to go, way to go. And if you needed a little more time, that is understandable. Coders, remember, these will be playbacks, so you can watch anytime and you can slow it down or speed it up. Again, you are the captain of this ship. All right, we got another scenario. Let's do it. Clyde has atrial fibrillation and requires digoxin. His blood work determined that he is overdosed on digoxin and requires intravenous digoxin immune fab. 2 vials were dispensed. Okay, coders, your time begins now. All right, what are your key words? If you said intravenous, that's your route, digoxin, immune fab, and your dose was 2 vials, outstanding. So they kind of, I kind of put it together. Intravenous, digoxin, immune fab. Make sure you grab all of the terms because that will help you. You'll see there are different variations of medication, and a single slip could put you at the wrong medication. All right, so let's go ahead to step 2. We're going to look up our drug in the table of drugs. Number 2 says, look at these digoxins. You have two. You have digoxin and you have digoxin immune fab. Okay, that's what I was talking about. So we grabbed all of the drug and it says per vial J1162. Now, step 3, we're going to verify. J1162, this is injection, digoxin, immune fab, ovine vial, per vial. So when you see per vial, you are to code the number of vials. And in our case, we have 2 vials. So after we check to see if there are any notes or guidelines, we're going to go ahead and code our answer, J1162 times 2 for 2 vials. Okay, coders, how are you doing? Is this getting clear? You getting close? All right, so some of you already know how to look up codes for, HCPCS injection codes. You already know it, but some of you are just learning. So if you already know it, go ahead and encourage those that are learning because that's what we do here at AMCI. Yeah, we're a team all the way around. Okay, coders, shout out to the people that are helping the others. Outstanding. Okay, we got one more. Donna had a urinary tract infection. The doctor administered an intramuscular injection of 1,000 milligrams of ceftriaxone sodium. Okay, coders, your time has already begun. You can and you will. All right, first things first. We have to document our keywords. Keywords, intramuscular, that's the route, right? The 1,000 milligrams is the amount or the dosage, and the ceftriaxone sodium, that is our drug. So hopefully you got those. Now it's time to look up the code. Step 2, ceftriaxone sodium. There you go. And as you can see, the dosage that they have listed is per 500 milligrams. And it can be administered intravenous or intramuscular. And the code J0715. Now, step 3. Let's go ahead and verify J0715. This is the code for injection ceftriaxone sodium per 500 milligrams. Okay, coders, we know what we have to do, right? 500 milligrams is not going to do it. We have to code for 1,000. But before we, select the code, let's go ahead and check guidelines and any notations. None are applicable, so we're going to go ahead and code 2 units of J0715. Okay, coders, how you doing? All right, I think you're getting it. For those, this is your first time, I just want to tell you you're doing an amazing job. For those that are reviewing, thank you so much for your patience. Now,
Thank you, Mrs. J, for those great instructions and coders. I can see you are really enjoying this exercise, and it's also great to see your energy and focus. So let's keep the momentum going and let's dive into a few more coding scenarios. And next, let's look for a HCPCS Level II code for a multifunction ventilator for home. And you got 1.5 minutes to solve, and your clock starts ticking now. And Ace the AMCI alligator is here, which means it's time's up. So, what is going to be your main term? Answer it in the chat. Yes, your main term is going to be ventilator. So all you have to do is go to your index, search for ventilator, and then you search for home ventilator. That would instruct you to look for the codes between E0465 to E0469, and then you have to verify your multifunction ventilator for home from those code series, and you will find that E0467 is coding for home ventilator multifunction respiratory device, also performs any or all of the addition functions of oxygen concentration, drug nebulization, aspiration, and cough stimulation includes all accessories, components, and supplies for all function. And your correct answer is E0467. So you have to verify that from your tabular list as well. Great coding. So quickly, let's go ahead and to another scenario. And here is your next question. What is a HCPCS Level II code for a specially sized wheelchair? And your time begins now. And time's up. Let me know in the chat coders what is your main term. You all are absolutely correct. The keyword is going to be wheelchair. So you have to go to the alphabetic index, search for wheelchair, specially sized, which will take you to two codes E1220 and E1230. So you have to verify it from the tabular list. So let's go to the tabular list and look into these two codes. E1220 is for wheelchair, specially sized. Now this looks like a good code selection. Let's look into the next one. E1230 is for power operated vehicle. It can be three or four wheel, non-highway. Specify the brand name and model number. So it was not documented as a power operated vehicle. No, we had to find the code for a specially sized wheelchair, and the most appropriate and the correct code is going to be E1220. Excellent, excellent coding. Let's move on to the next one. Next question. Here we go. Collagen meniscus implant procedure. What do you say, coders? Type your answers in the chat. And you all are doing a fantastic job rocking it in the chat. Great work. And we are looking for a collagen meniscus implant procedure. So collagen is going to be our main term. Go to your alphabetic index, search for collagen. That will straight away leads you to meniscus implant procedure. All you have to do is verify. So let's go to the tabular list. G0428 is coding for a collagen meniscus implant procedure for filling of meniscal defect. And that's exactly what we were looking at. We also have a code at G0429 that's for a dermal filler injection for treatment of facial lipodystrophy syndrome. So, no, we are not looking into that procedure. We are specifically looking at a collagen meniscus implant procedure. So, the correct answer is going to be, as most of you have said, it's going to be G0428. And you all did a great job in this one as well. It was a straightforward scenario. You all did a good job. Let's move on to the next one. What is the HCPCS Level II code for a prosthetic eye? Your time starts now. Encoders, you didn't need that 1.5 minute completely. And I can see your answers in the chat. Great coding. Our main term is going to be prosthetic. You're looking for a prosthetic eye. So your coding path should be prosthetic eye, which gives you code V2623. So go ahead to the tabular list and verify it. So it's coding for a prosthetic eye plastic custom, and that is your correct code. Good job. Now let's move on to next scenario. And next one, what is the HCPCS Level 2 codes for pediatric plaster short arm cast? Okay, goddess, go ahead and type your answers in the chat. Okay, okay, great answers. I can see a lot of great answers coming up in the chat. Okay, let me know, Goddess, what is going to be the main term for this question? Type it in the chat. Let me know. Correct. The main term for this scenario is going to be cast. And you can go to your index, search for cast. Under it, you can look at supplies, short arm cast, pediatric, and that would lead you to two codes, Q4011 and Q4012. So you have to go and verify the correct answer from the tabular list. So Q4011 is for cast supplies, short arm cast, pediatric plaster, while Q4012 is for cast supplies, short arm cast, pediatric fiberglass. So for our scenario, it was a pediatric plaster short arm cast and not a fiberglass cast. So the correct answer is going to be Q4011. Great job. And as I said previously, when searching the table of drugs and biologicals, search for the following: the name of the drug, the unit administered, how many units of drug was administered. Also, search for the route of administration, if whether it was an oral administered drug, whether it was an intravenous or subcutaneous. So you have to check for the route of administration as well. And pay attention to the conventions such as see or see also, and this will direct you to look into additional places to find the code. And finally, never code directly from the table of drugs and biologicals. Always go to your tabular list and verify the code before the final code assignment. So are you ready for more coding exercise? Yes, I know you all are. So let's go ahead and let's find the code for hydrocortisone sodium phosphate IM 25 mg. So Curtis, go ahead and place your answers in the chat. And you all are spot on with this scenario as well. And what is going to be our main term? You have to search for your main term in the table of drugs. Our main term is going to be, yes, it is going to be the drug name, and here it is going to be hydrocortisone sodium phosphate. And next we have to check for the dosage administered, and then method of administration. If you get all these three right, you're going to get your big score. So let's check what we have in our scenario. We have hydrocortisone sodium phosphate IM 25 mg. So the correct answer is going to be hydrocortisone sodium phosphate, dosage for up to 50 mg, and route of administration. We had intramuscular route of administration, so it falls over here. And the correct HIPIC code is going to be J1710. And we cannot stop here. We have to verify the code in the tabular list as well. So let's go ahead and verify the code in the tabular list. And yes, we have J1710 coding for injection hydrocortisone sodium phosphate up to 50 milligram. And J1710 is your correct answer. Wonderful coding. You all did a great job. The scenario. Let's do one more scenario on the drugs. And next is going to be Rosafin injection 250 milligram. Encoders, your time begins now. Wonderful, wonderful, wonderful coding. And let's let's see what the answer is going to be. Okay, so the main term is going to be Rocephin. So we have to look for the main term in our table of drugs. So first, the drug name followed by the dosage. We had a 250 milligram of Rocephin injected, followed by the method of administration. Rocephin was injected intravenously. If we get all these three correct, we'll get the correct HIPIC score as well. So let's look in the drug name. Let's look at Rocephin and dosage per 250 milligram. Method of administration, it can be IV or IM. We had an IV, so our correct HIPIC code is going to be J0696. So let's move on to the step 2 and verify the code in the tabular list. So J0696 is coding for injection ceftriaxone sodium per 250 milligram. Now you might be feeling a bit confused. We are looking for Rocephin and not for ceftriaxone. Well, in that case, you can read the language underneath the code. It states that utter Rocephin, and that means it's another name for ceftriaxone sodium. Yes, so ceftriaxone sodium can be also known as called as Rocephin. Okay, great coding. Wonderful. So let's move on. I've got one more scenario to go, and let's see. And next one is going to be Ventavis 20 MCG. Okay, Curtis, place your answers in the chat. Time's up, and let's go ahead and look into the code. So let's go ahead and look for our main term in the table of drugs. And main term is going to be Ventavis 20 microgram, and route of administration is not specified, and the HIPIC code should be Q4074. Let's verify in the tabular list. Q4074 is coding for Iloprost inhalation solution, FDA approved final product, non-compounded, administered through DME, unit dose form up to 20 microgram. And beneath that, you can see the other name for Iloprost. It would be Ventavis. Okay, so Q4074 is your correct answer. And you all did a fabulous job so far, coders. Great coding, and I think it's time for me to hand over to Miss J. Miss J, please, and thank you.
Thank you, Mr. Sandeep, for that awesome presentation on HCPCS Level 2. And before we go, coders, I want to tell you that HCPCS Level 2 codes are updated quarterly, so they change a lot. And if you want the most up to date, you can just go to cms.gov. Go there and type in the search bar HCPCS release. If you do that, you'll get the most up to date codes. Don't fret about it. A lot of students who are who want everything perfect, they really, have an issue with HCPCS because the codes are always changing. Even this presentation, at some point, the codes are going to be out of date. So don't fret, just go to cms.gov. Now, it's time. It's time to embrace a new subject, and that subject is modifiers. And you might say, well, we already were talking about modifiers. Indeed, we have been talking about modifiers in our discussion of HCPCS Level 2, but now we're going to talk about CPT modifiers. And what is a CPT modifier? Well, CPT modifier, just like a HCPCS Level 2 modifier, that's a two-character long code, and it is appended at the end of a CPT code or a HCPCS Level 2 code to report specific circumstances or alterations to a procedure, service, or medical equipment without changing the definition of a code. It's modifying the code. It could enhance it or decrease. Modifiers help clarify the procedures. And coders are required to use modifiers when appropriate to allow for proper reimbursement of services. And like we said before, there are two types of modifiers: CPT modifiers and HCPCS Level 2 modifiers. Again, you can recognize a CPT modifier because they are numbers. And a HCPCS Level 2 modifier, they have at least one letter. All right. So on the left, you have modifier 59, and on the right, you have LT. Here's a little more about CPT modifiers. Well, we already know, and I just want to make sure that I clarify and really emphasize that these modifiers, CPT modifiers, are appended to both CPT codes and HCPCS Level 2 codes, and they modify procedures and services, etc. Where are they located? Well, they're in your CPT manual. If you open up the front cover, just open it up. It's on the other side of the front cover. And also, they're in Appendix A of your CPT manual, and the definitions, the full definition of each modifier is located in Appendix A. Now, this is something you need to know. When reporting more than one modifier, you must sequence the functional modifier immediately after the code, followed by the information modifier. So if one code requires multiple modifiers, you sequence that functional one first. What does functional mean? In a nutshell, it means the modifier that impacts the money. Yes. All right, we're going to talk about it momentarily, but I do want to show you what the modifiers look like from the perspective of your CPT manual. And it looks like this. So if you open it up, go ahead and open up your CPT manuals. Inside, you should see these modifiers, and they're in numerical order, as well as a brief definition. I love this. I use this all the time. And once you start learning their meanings, it will be useful to you as well. So I just want to point out some common modifiers. Modifiers 22, 23, 25, 26, 32, 33, 50, 51, 52, 59, 62, 63. All right, so those are some common ones. Now let's take a look at Appendix A. This is where you get the full definition of that modifier. So we said 22 was a common modifier, and I actually used that example when I said a patient had a C-section, then they had a repeat C-section, and it was difficult the second time because of the adhesions. If the doctor wants to say, hey, this was difficult, then you would append 22 on that procedure code. And 22 is the definition, well, the modifier for increased procedural services when the work required to provide a service is substantially greater than typically required. It may be identified by adding modifier 22 to the usual procedure code. Documentation must support the substantial additional work and the reason for the additional work. Examples: increased intensity, time, technical difficulty of procedure, the severity of the patient's condition, physical and mental effort required. Note, this modifier should not be appended to an evaluation and management service. So I love this Appendix A when you're learning. It's gold. Now, I spoke about money, and that's what this boils down to. Certain modifiers impact the money. So if a procedure was more difficult, that 22 modifier, you better believe it, it increases the provider's money. And this is one example of how medical coders, trained medical coders, often help providers acquire the money that they're entitled. Do you know a non-trained coder? Because, sometimes billers just kind of migrate over to coding. Hey, I can code, but it's these little things. When to append that 22 modifier. And if a provider is listening, and a lot of them do listen, they do, if you have an increased procedure or service, your money could be impacted if you're not appending modifier 22. Just saying. All right, so certain modifiers are more functional than others, and they do impact the money. So if we look at this list, we've categorized either the meaning of the modifier, or see this minus or this O. Well, the O means you don't append, if you don't append this modifier, you're going to get zero reimbursement. So that definitely impacts your money. If you do append this modifier, it will decrease the payment. And you're saying, who would do that? I'm going to show you who's going to use one of these modifiers to decrease the payment. And it's not all, it's just some. And the plus means that when you do append this modifier, it will increase the payment. And we're talking about in this category is anesthesia, laboratory, other. Where's that 22? There it is. See, you use that modifier, it's going to increase the payment. Let's see. I means that when you append this modifier, it doesn't impact the payment, yet it's for informational purposes. So this is the modifier that you should append for information. All right, coders. So I just want to point out that we have a column for global package, evaluation and management, things that are bundled, the number of providers, anesthesia modifiers, lab modifiers, other, where we couldn't put them in a classification, outpatient hospital. All right. So this modifiers at a glance sheet could be helpful to some. Some people say it's very helpful. So the link is in the chat. Go ahead and use it, and it's also on your syllabus. And yeah, I'm going to just kind of point out some of those modifiers that are common. And yes, modifiers can be on multiple in multiple columns. Let's study together a few common modifiers. Now, modifier 95, this is the modifier for telemedicine or telehealth. And just so you know, when you look in CPT and next to codes, CPT codes, you'll see this star symbol. When you see that star, then that means you can code that procedure as a telemedicine or telehealth. All right. And the modifier is modifier 95 that you'll use. Also, in order to code for telemedicine, the provider must have both audio and video. If one is missing, then you cannot classify it as telemedicine or telehealth. Now, telehealth includes interaction between a provider and a patient who's located at a distant site, and Appendix P lists the only codes that Modifier 95 can be appended to. Now, instead of me just barking off these modifiers and their definitions, let's go ahead and let's do an exercise. Many of you already know modifiers, so this will be good for you. And those that don't, this is a good way for you to study as well. All right, I got a scenario. John had a bilateral hip replacement today. Go ahead, type in the chat the modifier for bilateral procedures. So if you open up Appendix A, you can find it. If you open up the inside cover of your CPT manual, you can find it there as well. You can probably scan a little faster. So I'll give you a few moments. And now, keyword bilateral. What is the modifier? If you said modifier 50, outstanding. So yes, modifier 50, if you go to Appendix A, is the modifier for bilateral procedures unless otherwise identified in the listings. Bilateral procedures that are performed at the same session should be identified by adding modifier 50 to the appropriate 5-digit code. Note, this modifier should not be appended to designated add-on codes. So when you have an add-on code, don't use that modifier 50. Okay, how'd you do? If you got it correct, outstanding. Okay, I got another one. A patient is given general anesthesia by the surgeon. Okay, coders, go ahead, put your answers in the chat. Which modifier? All right, so our key term is general anesthesia by the surgeon. Coders, typically anesthesia is provided by the anesthesiologist or the nurse anesthetist. But when the surgeon who's carrying out the surgery also administers the anesthesia, general anesthesia, you will need to append modifier 47. So this is the modifier for regional or general anesthesia provided by the surgeon. It may be reported by adding modifier 47 to the basic service. So your surgery code, That is the code that you use, and you'll append modifier 47. And this does not include local anesthesia. Remember, this is general and regional anesthesia. And modifier 47 would not be used as a modifier for the anesthesia procedures. So anesthesia have their own modifiers, and you will append this modifier 47 to CPT procedure code. All right, how'd you do? If you learned something, that is priceless. All right, I got another. What modifier is used to report the professional component of a service? Okay, coders, what say you? Go ahead, scan the modifiers from the cover, from the inside cover of your CPT manual. Okay, so if you said that the keyword is professional component, very good. And the modifier is modifier 26. So if we read Appendix A definition, it says certain procedures are a combination of a physician or other qualified health professional component and a technical component. When the physician or other qualified healthcare professional component is reported separately, the service may be identified by using modifier 26 to the usual procedure number. Okay, coders, that doesn't do it for me, and we are going to have a quick discussion about modifier 26. All right, so hang tight. But if you got that correct, outstanding. What modifiers used to report the technical component of a service? What say you, coders? Go ahead, type your answers in the chat. All right. So if you said the key word is technical component, way to go. It is. And the modifier is modifier TC. This is a HCPCS Level II modifier. And if you look in the HCPCS manual, you'll see TC manual, you'll see the TC modifier definition. Also, there are some HCPCS modifiers in your CPT manual. So you probably see this TC in your CPT manual. If you don't, then they've updated. I just didn't check. All right, but anyway, it says technical component. Under certain circumstances, a charge may be made for the technical component alone. Under those circumstances, the technical component charge is identified by adding modifier TC to the usual procedure number. Technical component charges are institutional charges and not billed separately by physicians. However, portable X-ray suppliers only bill for technical components and should utilize TC. The data charge from portable X-ray suppliers will then be used to build customary and prevailing profiles. Anybody know what that means? Okay, coders, let's get into it. Let's learn about modifiers 26 and TC. We are going to have a discussion, and at the end of this discussion, I hope someone will have a better understanding of how to use these two modifiers. When you go to a hospital to get an x-ray, a chest x-ray, the code is 71045. And there is a presumption that the hospital is providing or owns everything. They employ the radiologist, they have the imaging equipment, they provide any supplies, they employ the technician, right? So when you see that radiology code 71045 and practically all of the radiology codes, there's a presumption that the hospital owns everything and is providing everything and all of the services. You all with me? Now, what if the hospital does not employ the radiologist? How will the radiologist bill for her services? How will she do it? Well, when the radiologist is not employed by the hospital, the radiologist will have to bill for the professional services or the professional component of that global code. And it will look like this: 7104526 modifier. So earlier I said that 26 modifier will decrease the payment. Why does it decrease the payment? Because this radiologist isn't providing all of the services of 71045. She's only providing a the professional part or the professional component of that code, so she's not entitled to the entire code. So when she appends that 26 modifier, she will get the amount, the reduced amount that she is entitled to. So hopefully that makes sense. Okay, now that we've spoken about 26 modifier, let's go ahead and talk about the technical component. All right. So the technical component is the technical piece of that global code, right? Let's say the hospital's imaging equipment breaks down. Let's say the x ray machine breaks down and they bring in a mobile x ray provider. How will the mobile x ray provider bill for their services? They'll only they're only able to bill for the technical component of that global code, and they will use modifier TC. So hopefully that makes sense. And this is how you use modifier 26 and modifier TC. All right, let's continue studying. What modifier is used to indicate multiple procedures on the same body system? Okay, coders, what say you? I'll give you a moment or two. Go ahead, scan your CPT manual inside cover. Okay, coders, if you said multiple procedures is your key word and same body system, that is modifier 51. Now, some people confuse modifiers 50, 51, and 59. And if you need more clarification, go to Appendix A and it explains what multiple procedures are. So, pretty much, it's multiple procedures in the same body system. And remember, always place this modifier 51 on the second procedure. You don't do it on the first because this modifier 51 actually reduces the payment. And if you put it on the first procedure, then that first procedure is often going to be your primary with the most cost associated. And if you do that, it will reduce that payment for the most cost. So the provider will get reduced payment. And also, never use this modifier 51 with add-on codes. And also, too, if you read the code language, It will tell you that too. In your parenthetical guidelines, it will say don't use this code with modifier 51, etc. All right, I got another one. Oh, how'd you do? If you got that correct, outstanding. But if you learned something, that is priceless. Okay, got another one. What modifier is used to indicate distinct or different procedural services? What say you, coders? Keyword, distinct or different procedures. Yes, when a provider carries out a distinct or different procedural service, use modifier 59. So, in other words, this is when the provider carries out more than one procedure and they are they're distinctly different. All right, so I know that can be confusing, but definitely go check out Modifier 59 in Appendix A. Go read it. And I want to clarify modifiers 59, 51, and 50. So many people confuse these modifiers because they represent multiple procedures. Well, not so much bilateral, but let's go ahead and let's take a look at them side by side. When you have modifier 59, this represents distinct or different. It means a different procedure or a different body part. Modifier 51 means multiple procedures from the same body system or body part. And modifier 50 is bilateral, and that means the exact same procedure on both or opposite sides of the body. Now, let's go ahead and test our knowledge. All right, so we've got three scenarios here, and we'll deal with the first one. I want to know, is this modifier 50, 51, or 59? All right, so John had a hip replacement of both right and left hips. Which modifier would you use? 50, 51, or 59? If you said 50, bilateral, outstanding. Okay, so SC had a biopsy of the jejunum and a biopsy of the duodenum. Is it modifier 50, 51, or 59? What say you? All right, so 51. We would append 51 on the second procedure. So we'll determine, is the jejunum or duodenum more comprehensive? Whichever is comprehensive, we'll sequence that first, followed by the second procedure with a 51 modifier. Why this is 51? Because we had the same procedure, biopsy, on the same body area. Well, you might say, no, it isn't. Jejunum and duodenum are different. No, they are both the small intestine. They're both a part of the small intestine. So you can use modifier 51. All right, last one. Jamie had a tonsillectomy and her appendix was removed. Okay, which modifier would you use? Okay, so if you said 59, outstanding, because these are different body areas and different procedures, so doubly different, right? They're distinctly different. Now, did you know that modifier 59 is one of the most misused modifiers? Yes, because we're talking about money now. Let's talk about money. Modifier 50 reduces the payment for that second procedure. Modifier 51 reduces the payment for that second procedure or subsequent procedures. Modifier 59 does not reduce the payment, it gives you the full payment. So some providers misuse this modifier. Yeah, they misuse it. Instead of using the appropriate one, they'll use modifier 59. They get that full payout. So CMS came up with some modifiers to use in lieu of modifier 59. And let's go ahead and evaluate them. All right, so here are the modifiers that you use in lieu of 59. Modifier XE, modifier XP, modifier XS, and modifier XU. Modifier XE is the modifier that you use for a separate encounter. A service is distinct because it occurred during a separate encounter. So that means a patient had two visits in one day. Yeah, so sometimes you can't distinguish someone. Traditionally, a provider would code for the first visit, and the second visit would get that 59 modifier. Now we use modifier XE. Yeah. My modifier XP means separate practitioner, a service that's distinct because it was performed by a different practitioner in that practice, right? So a patient saw two doctors in one visit. Let's say a patient saw the dermatologist, and then the dermatologist may have seen something and called in their associate, like, hey, can you take a look at this? And that associate is an expert, or maybe oncology. Maybe they have, you know, dermatology oncology as their um, expert. Okay. Now, modifier XS. This is separate structure, a service that's distinct because it was performed on a separate organ or structure, the different body system, right? They came in, they had procedures, different procedures on different structures, or same procedure on different structures. You use modifier XS. And finally, modifier XU. This is unusual, non overlapping service. The use of a service that's distinct because it does not overlap usual components of the main service. This seems like it's difficult. It's not. It just means that typically the surgery overlaps, but in this case, it doesn't. And I'm going to give you an example. Now, just want to tell you that you are to use these modifiers in the real world if applicable. So they say don't use modifier 59 if any of these XE, XP, XS, or XU is more appropriate. Now, let's go ahead and let's have a grown folks discussion on modifiers. Meet Sophie. Sophie had always been a healthy, vibrant young woman, but her life took a dramatic turn. She was recently diagnosed with uterus didelphys. Uterus didelphys is a rare congenital condition, and it's characterized by the presence of two separate uterus. Now, on the left, you can see a normal uterus, right? This is your normal uterus. But patients with uterus didelphys, they've got two uterus. And not only do they have two uterus, they've got two cervix and sometimes two vaginas. This complex reproductive anomaly results from incomplete fusion of the Mullerian ducts. And this is during fetal development, so it is congenital. And if you're curious like me, you want to know what two vaginas look like, it looks something like this. Again, something like this, coders. This is a pig's nose, but it looks like that. Go ahead and look it up. And two uterus can look like this. Despite the diagnosis, Sophie was told that it was still possible for her to conceive. Although there were risks, she could conceive. And you know what? One day she found out she was pregnant. And it was a shock to her because she had been using birth control. However, it failed. So she scurries on over to the doctor to confirm her pregnancy. And you know what? The doctor says you are pregnant indeed. And the doctor carries out an ultrasound to see how the baby is progressing. And during that ultrasound, it confirmed two fetuses. And the fetus were not in the same uterus. They were in separate uteruses, and there is more. The left uterus, in the left uterus, the fetus was 11 weeks, and in the right, the fetus was 23 weeks. So that means that Sophie's babies were conceived almost 3 months apart. And what's worse, Sophie will have to give birth twice. But can you imagine what's even worse than having two deliveries within 3 months? The infants were conceived by two different men. Her boyfriend is in the military, and the 11-week fetus could not possibly be his because he's in the military. He was deployed. So the 11-week fetus is her friend's baby. So, needless to say, Sophie has some explaining to do. And of course, she was overwhelmed with a lot. She's a lot on her plate, but she still she decided to keep both babies and move forward with the pregnancy. Although Sophie had a lot of complications, she ultimately delivered both infants. The first was born at 35 weeks, and the second was 12 weeks after that. Now, let's bring it on home. After these babies were born, both of Sophie's uterus prolapsed. So she's going to need a hysterectomy. Now, this is where the coders do their work. First, let's talk about uterine prolapse. Uterine prolapse is a condition when the uterus descends into or outside of the vagina. And this level that you see here, level of introitus, this is the um, area or where the urethra is. So when the uterus prolapses, it goes beyond that, and you can actually see it. So I'm not sure which degree Sophie was, but as you can see, it could get pretty, extensive. So she needed a hysterectomy. Let's code it. All right. A woman with didelphys presents to the OR for a vaginal hysterectomy. She's going to have uterus, a 20-gram uterus hysterectomy, and a total abdominal hysterectomy. And you need to code the encounter. So if you'd like, go ahead and code it. If you don't know, I understand. Look up hysterectomy, and there you go. But the purpose of this exercise is to demonstrate modifier use. All right. So if you look up hysterectomy, it will take you here. You've got 58260 and 58262. 5826260 is vaginal hysterectomies for uterus 250 grams or less. And then 58262 is vaginal hysterectomy with removal of tubes and ovaries. Now, 58150, this is a total abdominal hysterectomy. I like this. All right, so I like 58260 and I like 58150. This is total abdominal hysterectomy with or without removal of tubes. A total means that they remove the uterus and the cervix, right? Yeah, so she did have those procedures. So I would code both of these. And the one I would sequence first would be 58150. This is more complex because it includes the cervix, right? 58260, they just remove the uterus, right? However, coders, most women have one uterus, right? They do. So the systems are designed to represent what is usual and customary, what is common. So we will need to tell the system, the insurance payer system, that this is an unusual, non overlapping service. This is an unusual circumstance, right? This patient has two uterus and they do not overlap. The use of a service that is distinct because it does not overlap usual components of the main service. And this is how you would code it. You would sequence first your total abdominal hysterectomy, second, your vaginal hysterectomy for that 200-gram uterus, and you would append modifier XU. And this is the same body part. Yeah. But you would not use that 51 modifier. If you did, you would not get paid. They're going to say, "What are you talking about?" Right? So these modifiers are to be used in lieu of modifier 59. If you append that modifier 59, the computer would kick it back and say this is not correct. But this modifier XU says, hey, it is correct. We know this typically overlaps, but not in this case. So this is how you use modifier XU. Okay, coders. As we near the end, I've got one question for you. Are these infants twins? What do you think? Are they twins? Yes or no? Well, the medical definition of a twin is one of two offspring produced in the same pregnancy. Twins occur about once in every 86 months. So, according to this definition, coders, the answer is yes. Yes, it is. So, yeah, I might say no because of the Delphus, but the definition says otherwise. Okay, coders, this is it. We are finished. Today we reviewed HCPCS Level II coding, modifiers. We practiced coding with modifiers in some HCPCS Level II, and hopefully we brought you one step closer to coding mastery. Now, before we go, there's a few things that I want to tell you. I want to tell you how to join Discord, and I placed it on your syllabus so you can have the instructions there. But number one, you have to become a YouTube member. After you become a member, you go join Discord. You got to click there. And you can become a member by clicking that join button next to any lecture that we have on YouTube. After joining Discord, you'll need to go into Discord and by your picture, you'll see a cog wheel right here to the right of your picture. Click it, then click connections, then you need to add the YouTube channel. So click connections, add YouTube channel, then follow the prompts, and you're connected. That's it. Now, let's talk about the homework. All right, so to get the homework, if this is your first time watching, go ahead to our website, www.amcicoding.com, click on YouTube course, and you're going to look for the syllabus. Coders, not coders, team, put the syllabus link in the chat if anyone needs it. You don't have to go to the website. The syllabus link is in the chat. When you get to the web page, read everything, then scroll down, you'll find the syllabus here. When you click on that syllabus, you'll see the books at the top. Then, number one, the class PowerPoint playback or the handout. It's available in Discord. Number two, you can watch this playback by clicking this green link. Number three, you will need to read Bucks, Unit 3, Chapter 9, HCPCS Level 2. Number four, we have supplemental lectures on HCPCS. Go ahead and read it. Number five, there's another reading assignment on modifiers. This is Unit 3, Chapter 10 in Bucks. Number six, there's an additional lecture on modifiers 50, 51, and 59. It's quite good. So check it out. And number seven, if you're new to CPT coding, go ahead and get ahead. Click this link. We have Introduction to CPT lectures. Go ahead. And modifiers, that modifiers handout that I showed you about the money, if you need it, it's right there. Don't forget, we're going to begin CPT integumentary coding instruction next week. And if you need brushing up, go ahead and watch those introduction to CPT coding. Or if you're new, definitely watch. All right, we'll see you then. But we want to thank you and make sure that you complete the survey. Completing that survey helps us help you and also If you liked this presentation, please like up week 9. If you didn't like it, go ahead and give us a thumbs down. We need to know. And I want to thank my amazing team. I want to recognize you for the exceptional work that each of you are doing. Your knowledge, commitment, and unwavering support makes all the difference to me and our students. So, again, coders, why do I call my team coders? I don't know. Please, they know who I'm talking about. Thank you for bringing your best every day. Thank you to the intern team. You are the heartbeat of AMCI. And I just want to tell you, in both coding and life, this is for you coders. Conquering challenges empowers us. So let's nail this final stretch together, coders. This is the final stretch. So go study, go practice, and go be great. See you in the next session.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.